How nurses and doctors can use ChatGPT to save time, reduce burnout, and improve care.
GPT-5 is able to predict the outcomes of experiments that we haven't even done. That saves us weeks, sometimes months. Fundamentally, it will change the way we do science. Now I'm interacting with a model that knows more than me on my own field. It's beyond collaborator, it's almost like a mentor. GPT-5 will help the patients to advocate for themselves. And I think that will empower the patients to feel more confident when they talk to their doctors.
I remember this moment when I was first kind of playing around with an early version of ChatGPT and really starting to realize, like, wow, if we could somehow bring this into the clinician workflow, think of what that could do to improve our quality. Let's take a look at how the AI consult works in action. In this clinical encounter, we're seeing a 1-year, 10-month-old child who has gastroenteritis. There are some signs on physical exam of dehydration. One common error that we see is that clinicians prescribe antibiotics instead of more evidence-based treatments. I'm going to start by prescribing metronidazole tablets. You can see this blue shimmery icon, which is showing that the AI consult is working. It returns a red alert, which reminds me that metronidazole is not indicated for gastroenteritis with mild dehydration. It also reminds me that I haven't prescribed ORS or zinc supplementation. I'm going to remove the metronidazole prescription and I'm going to add oral rehydration salts as well as zinc. Again, you can see the AI consult tool runs, and in this case it returns a green tick. The AI feedback says that the treatment plan aligns with IMNCI guidelines for gastroenteritis with mild dehydration, and it recommends continuing the current treatment plan.
ChatGPT is a conversational AI created by OpenAI. Think of it as a supercharged autocomplete. You type in a question or a task and it generates human-like responses, full sentences, summaries, even documents. In healthcare, it can draft discharge summaries, simplify medical jargon for patients, and even help you study for exams. But remember, it doesn't actually understand medicine, and you should never enter patient identifiable information. Practical use cases for healthcare workers. ChatGPT could be used for clinical documentation, education and training, administration and management, patient communication, personal productivity and well-being. Clinical documentation. Documentation is one of the biggest time sinks. ChatGPT can create first drafts of discharge summaries, SOAP notes, or referral letters, which you then review and finalize. For example, you could prompt, write a draft discharge summary for a patient with pneumonia treated with IV antibiotics, now discharged on oral antibiotics. Education and training. Medical knowledge doubles every few months, and keeping up is tough. ChatGPT can help by summarizing journal articles, creating mnemonics, generating quiz questions, or simulating patient cases. Nurse educators use it to prep quizzes in minutes instead of hours. Administration and management. Emails, policies, and staff briefings take hours. ChatGPT can draft professional emails, summarize long policy documents, or even create project timeline. Imagine converting a 40-page policy into one-page staff briefing in minutes. Patient communication. Patients often leave confused by medical jargon. ChatGPT can rewrite explanations in plain English, create culturally sensitive handouts, or translate materials. For example, instead of saying hypertension, you can have ChatGPT explain it as high blood pressure, like water pushing too hard on the walls of a pipe. Personal productivity and well-being. Finally, don't forget yourself. ChatGPT can help plan meals, design self-care routines, or suggest stress management tips for shift workers. Think of it as a personal assistant that helps you thrive, not just survive. How to use ChatGPT safely and effectively. ChatGPT prompt structure for better output. Getting good results is all about the prompt. Use this simple formula: role plus task plus context plus format. For example, act as a nurse educator. Create 5 multiple choice questions on diabetes management for final year students. When using ChatGPT, do anonymize details, use it for drafts, fact-checked against guidelines. However, don't enter protected health information, rely on it for final decisions, or assume it is always accurate. Benefits and opportunities. When used well, ChatGPT can save hours of admin time, reduce burnout, improve patient understanding, support lifelong learning. It is not replacing us, it is helping us to focus on what matters most: caring for patients. ChatGPT won't replace clinicians, but clinicians who use AI wisely will have more time for their patients. Try it for one small task this week. Maybe an email, a summary, or a patient handout. If you want more tips, prompts, and tools for using AI in healthcare, visit ainurse360.com and download our free guide, The Clinician's Guide to AI in Healthcare. And don't forget to like, subscribe, and share this video to support healthcare professionals everywhere. Thank you.